This is stature and weight. Stature and weight. So he has BMI 16, 19, 22, 25. And what you see in these concentric circles is the life expectancy curves giving a measure of life expectancy, productivity, and economic growth. So he linked the trajectory of the French people in terms of their height from 1705 to 1975. In 1705, they measured 1.6 meters, less than the Tunisian, less than the Moroccan now. And they weighed 48 kilos. In 1975, they're at 75, and they measure 1.75. You can see the BMI, 22. So they move from a high mortality to a low mortality. This is what we would like. We would like to aim for that 0.7. This is less than the average mortality. What are developing countries doing? This is what they're doing. They're getting fatter and not necessarily taller. So we're not following the track of countries that went through development and gained the benefit. We're going in this direction. Some countries are even flatter, are getting more fat than improved length. And obviously, this has a tremendous economic impact, as has been pointed out by Fogel. Thank you very much for your attention, and this is the team of my co-workers.
Thank you. Thank you very much indeed, Prof. For those who join us late, we have been with Professor Ricardo UAUY, a professor of public health, a well-known guru. In fact, you know, he brought a very valuable scientific and data that might enrich your information or your knowledge and further application in your future work. With this, may I open the floor for discussion? You have 10 minutes, please. Thank you.
I want to have a qualifier. I'm not an economist. At MIT, I took micro and macroeconomics from Lance Taylor for 2 semesters, but that's as far as I go with economics.
Al-As'ila, floor. Any question, please? Yes.
Oui, bonjour. Je vous remercie pour vraiment cette communication que je trouve très, très intéressante. J'ai tout de même une petite question qui m'a interpellée au moment où vous avez parlé de jeunes filles qui, déjà à l'âge de 7 ans, commencent à développer, bon, qui font une obésité, mais qui ont déjà une petite poitrine, etc. Ce qui m'a interpellée, c'est par rapport, non pas uniquement les nutriments, qui sont bien sûr à la base de l'obésité, etc., mais aussi autre chose que on sait que dans plusieurs pays, il y a des hormones qui sont utilisées pour la croissance des animaux. Et j'aimerais savoir, est-ce que vous avez fait rentrer cette donnée éventuellement dans l'alimentation de ces pays sur lesquels vous avez fait cette étude? Merci.
They're called are sometimes additives, sometimes are pesticides. So the way we produce our food and the way we take care of our environment will have an effect on body fat and on body burden of these products. In fact, they act as if they were hormones at very, very low dose, picograms or micrograms. So we don't even notice them unless you're monitoring. In our study, we have established collaborations, and we will have measurements from the blood. The problem, though, is that the body burden compounds, and obviously this is a matter of concern. And data already exists to show that people or children that have been exposed to these endocrine disruptors can modify, depending on the endocrine disruptor, accelerate or decelerate in a dose-dependent fashion. So yes, it's important, Unfortunately, we don't have a world picture of that. There are a few spots here and there. Scandinavia is doing a good job at this, and this may be affecting children from birth. Breast milk concentrates lipophilic compounds such as this. So I'm not saying that mothers should not breastfeed. We should have a clean environment so that breast milk is not contaminated with these dioxin-like compounds. Very important, I would put it in the agenda. Now, if you have malnutrition, try to address that together. But definitely a clean environment, clean production, and clean water are essential, and we do not know the magnitude of this. We're just starting to see this.
Any more questions?
Thank you for your very enlightening talk. I just wanted to know if there are any country programs that are now looking at stunting as a national problem and addressing in a strategic way.
First, from the standpoint of the priorities, unfortunately, even WHO and FAO took a long time to put stunting on the map. They were mainly focusing on weight. So the MDG was defined on weight, unfortunately. But I think we need to interpret it that healthy growth, that's why the term should be healthy growth. It's height and weight, and height is probably the most relevant. The issue, though, is that we need to put, in Latin America, stunting is definitely the main problem, the brain nutrition, and the worldwide too. So it's up to us, and I think we are to blame because we accepted weight as an index because they told us that height could not be measured. It was difficult. That's up to us. But you're proving me wrong because you've said that you're not measuring height. I hope that next time I come, is Mansour in the room? He's not in the room, you see. I'm also disappointed because Mansour was here for the opening, but not today. Oh, good, very good. He's here. Okay, so I'm not disappointed. So this is an example of a commitment. He said, when I'll go back to Morocco, so every time I come, he's here. So yes, I think this should be in our first item of the agenda. The metrics define the problem. If we only measure MDGs based on weight, we'll never get it done. Yes?
Yes, please.
Somebody in the back also.
Bonjour, merci pour la conférence. Je voulais juste vous poser la question sur le fait que l'obésité, n'est-ce pas l'effet de l'épidémie de l'obésité, n'est-il pas un effet pervers de l'occidentalisation du tiers-monde? Et voilà la question.
Merci. I think we blame it on ourselves because we've accepted, we've taken that as a standard. If people have more, whatever, intelligence, you say, let me wait before I take your habits. Let me see what is healthy about what I do, and then I look at what you tell me to do. We've been told to do many things. We're told that legumes were for the chickpeas, chicken peas. Professor Swaminathan said in India, all of the local crops were degraded because they were given to the animals. That's the way a Western culture thought that food was meat, eggs, and beef. They're paying the price. We're starting to pay the price too. Maybe we rescue the legumes. How many of you have your daily portion? My grandmother told me that I had to have chickpeas and lentils 3 or 4 times a week. My grandmother was from Palestine. And in fact, those are the foods of this region. Meat, little pieces of mutton, and of animals that did not have a lot of fat. So we should preserve the cultures that we evolved with. There may be some good things, but there also may be some bad things about adopting, because we as scientists accepted that proteins would be measured one at a time on rats growing 20 times faster. Nobody eats a single source of protein. So the people, the Maya people in Central America were told, your diet is very bad. It's corn and beans. If you match the corn and the beans in the proportion they were using, it had a perfect amino acid complementarity. 10% difference in digestibility, so-called anti-nutritional, they're all now health factors. Having lipase inhibitors is a great thing. Having amylase inhibitors is a great thing. So let's rescue our foods. So my suggestion would be that you concentrate on your food culture and make the best out of it. And if we need, we can bring some other foods. But I think we have neglected our role as scientists in rescuing food-based approaches to the solution of our problems.
Yeah. I just want to add my voice to Professor this Mansour, being one of the very active scientists in this region for the last decade, and we are really, appreciate, his work whether on international level or on regional level. Can we have your question? And we have only 3 minutes actually to shift for the second one. So we'll have Mansour and Dr. Nawal here.
Professor UAUY, we start with 5 a day, then 6 a day, then 7 a day, and today I heard 8 a day. Okay, point of clarification. Is it the frequency, the number of times a day, more important than the quantity? Can we have it, the 500 grams, 600 grams, in 2 times or 3 times?
And from food intake, we don't have controlled studies, and it's mainly vegetables and fruit in that order. So it's actually, this also comes from the study of the epidemiology of disease around the world. And although we are saying 5 a day, the lowest mortalities related to cancer and chronic disease is when it's higher than that. And the data has actually been analyzed by WHO in the burden of disease. There's a good paper by Karen Locke in the Lancet on consumption of fruits and vegetables and decreased mortality. Cardiovascular, cancer rates, and obesity. The diabetes, the cancer rates for the vegetables, not the fruits.
Yes, Dr. Nawal, please, short.
Perspective, and then your presentation this morning, it just makes me, and I'm sure my feeling is shared by other people, that it's a big responsibility on our shoulders. We want to do more. We want to do better. We want to improve the situation for our next generations and the children and so on. But you mentioned something yesterday when you asked about advocacy. It's a challenge to do our work, but it's also a bigger challenge for us to keep this on the agenda of the decision makers. It's a very, very challenging situation for us. It's very worrying for us because we have the worst data maybe in the world with regard to whether it's non-communicable diseases or malnutrition. But it's a big problem for us.
Where are the journalists?
Yes.
I think the advocacy you need to practice every day. The Moroccan Nutrition Society needs to be every week with a message to the public.
Well, thank you very much indeed. I see, there's so many hands raised there. Well, I promise, to open the floor.